So most patients think scans give answers, but sometimes they can cause more issues, and that's why we don't always organize scans as doctors. So I'm Dr. Matthew Gloudeman. I've been a doctor for nearly a decade. I've worked from pediatrics to palliative care, hospital and community settings. And in this video, I'm going to walk you through the key question that I and many doctors will ask about whether or not a scan or a test is important to do, some of the problems that can arise if you do have a scan that you should be aware of, and when you should actually push for a scan or when you should advocate for yourself. So there's circumstances where I think scanning is really important, circumstances where maybe it doesn't add too much value. So first one, the question that I often ask myself when a patient's asking me if they should have a scan, or what I think is this test, is this scan going to change outcomes for this patient? So an example, if you're asking, they've got a chest infection or a suspected chest infection, and they're wondering about getting a chest x-ray to confirm that. First of all, not all chest infections or bacterial infections warrant a chest x-ray, and they might not all show up with florid signs of an infection. Doesn't mean that they don't warrant treatment. So sometimes if I'm thinking, look, it's not going to change my management at all, I might just give you some antibiotics if that's what's appropriate. And then if things are getting worse or progressive, that's when I'm thinking maybe we do a scan. Now the caveat is if someone's coughing up blood, that's a little bit abnormal. If they're losing weight that you can't explain, like a 5% or more weight loss as a rough guide, that would be worrying to me. The other one will be like, if you're having persistent cough, I usually give about a 6-week window, or if you're still coughing after 6 weeks, then a chest x-ray seems to be quite appropriate from my perspective. Another example would be like knee pain, hip pain. If a patient in their 60s, 70s, 80s comes to me and they're having knee pain and they're wondering about an x-ray of that area, is it going to change what we think about in terms of management? Maybe, maybe not. Depends on the clinical history, obviously, and that's what you should discuss with your doctor. But most people in that age bracket are going to have some degree of degenerative changes in their hip or their knee from walking around. So that means like chronic changes in their knee. Is that going to change what we do? Usually it's targeted physiotherapy for 3 to 6 months. See if their pain improves, maybe manage with some painkillers if we need to. And then the idea after that is, well, you're teed up for a possible surgery if you needed one, depending on what the clinical picture looks like. And an x-ray doesn't really change how we manage that situation. So again, there's reasons for and reasons against doing a scan, and it's something you can discuss with your doctor. So what are the problems that could arise with a scan? Incidental findings is the big one. What does that mean? It means we find something on a scan that we normally wouldn't be bothered by, but it's there, so we can't ignore it. So maybe you have like a small cyst or something like that on a kidney or a liver. Now, sometimes there's a human cost. That means you have to go take off of work and go back and forth for scans a couple times a year, or they're monitoring after 3 months, 6 months. There's a lot of stress for patients involved with that scanning. Sometimes they're doing biopsies, and that can result in extra problems, infections. So, and then maybe that cyst that we found on the scan had no problems whatsoever. You would never know it was there, and it would never bother you. Now, obviously, there's the flip side of that, which is we scan, we find something unexpected that is serious and worrying. So, when should you actually push for a scan? When should you think about trying to advocate for that with your doctor? Usually, if you're having worsening, persistent symptoms that are still unexplained, maybe you've talked to your doctor a couple times and we're not sure what's going on, then maybe you're starting to advocate, well, what do you think? Should we get a scan involved? Should we get a specialist involved? The next thing would be unexplained weight loss. I alluded to that, mentioned it earlier. I usually get a little bit more twitchy and worried if somebody's losing more than 5% as a rough guide of body weight in a short period of time, 3, 6, 12 months. And the reason for that is we're always worrying a little bit more about cancerous things. Normal body fluctuation for context is like 3% up or down, but losing weight that we can't explain, we tend to be more worried. The third thing that I would be thinking you should be advocating, pushing for a scan, might be a strong family history of something concerning. And I think these are always a negotiation with patients and doctors in terms of, Let's say you present with me, you're worried about this family history. Good example would be like pancreatic cancer, which sometimes can be difficult to pick up early because it has this, we call it insidious, meaning like you don't really get much in the way of symptoms. But if that's a strong family history, like multiple, first degree relatives, mom, dad, brother, sisters have had that, then you're going to always be a little bit more worried. And anytime you're getting some abdominal pain, especially at the top part of your abdomen, you might be worried. So that's when you might be thinking and negotiating with your clinician, well, I'm having these symptoms. I know this strong family history. Could we get a scan? And that is something that I tend to be thinking more along the lines of, even from a stress standpoint, doing a scan might be more appropriate in those circumstances. So I think the take-home message for you is good medicine isn't about doing every test under the sun. It's about doing the right test for you at the right time. And that's what you should be talking with your doctor about. Hope this video helped you. Thank you for watching.